joining us for Unite for Sight's webinar about a toolkit for taking programs to the next level. We have more than 500 participants in today's webinar, and we're thrilled to have all of you with us here today. My name is Jennifer Staple-Clark, and I'm founder and Chief Executive Officer of Unite for Sight. I'll briefly introduce you to Unite for Sight, review the webinar logistics, and then we'll hear from our expert panelists. To begin, Unite for Sight is a global health nonprofit organization that promotes high-quality health, and we offer extensive global health and social entrepreneurship education programs. Our Global Health University program offers this free webinar series, including today's webinar, and we also offer 20 online certificate programs for students and professionals. And many students receive academic credit for completion of our certificates, and many professionals use the certificate completion for their own professional development as well. And the certificate types range from a certificate in global health and a certificate in global health research to a certificate in social entrepreneurship, as well as 17 other certificate programs as well. And we have 4 more upcoming webinars during October, November, and December. And all the details about those various webinars can be seen on our website at uniteforsight.org/webinars. And you can see in the list on your visuals today in the webinar, we have one about strategies for growing and scaling organizations coming up in October, as well as one on cultural competency in November, as well as another in November about tools for effective research, monitoring, and evaluation. And then in December, we have a webinar about research and advocacy to curb the health impacts of environmental contaminants. Additional educational opportunities for both students and professionals include our events, and we have global health and social entrepreneurship events, which focus on responsible global engagement. Our 3rd annual Social Entrepreneurship Institute will be on Friday, October 30th, and our 13th annual Global Health and Innovation Conference will be on April 16th and 17th of 2016 at Yale University. And the Global Health and Innovation Conference is the world's largest global health and social entrepreneurship conference. And the conference website, abstract submission details, and registration can be seen at www.uniteforsight.org/conference. The Global Health and Innovation Conference also includes an innovation prize, which is a $10,000 cash prize as well as a $2,000 cash prize to the 2 best pitch presentations at the Global Health and Innovation Conference in April. And the Innovation Prize supports outstanding ideas, programs, and organizations which are locally developed and locally responsible. The Innovation Prize semifinalists and 5 presentations at the conference are judged by 5 expert panelists during the event itself, and one of the expert panelists as well is Jordan Levy, who is a panelist in today's webinar. In addition to these educational events, we also have a health care delivery that provides care to patients living in extreme poverty. And we partner with phenomenal local eye clinics in Ghana, Honduras, and India to provide quality eye care to patients who are not otherwise able to access or afford care. And these programs are locally led and locally managed by the local medical professionals. And this collaboration has provided eye care to 2 million people by locals during the past decade, including more than 90,000 sight-restoring surgeries by local ophthalmologists. Unite for Sight is the world's only organization that is a healthcare delivery organization that also offers immersive global health education and social entrepreneurship opportunities for students and professionals. We have participants who support and learn from the local doctors in Ghana, Honduras, and India, as the local doctors provide care to patients living in poverty in villages, slums, and refugee camps. And the participants then have the opportunity to learn from the local medical professionals about patient barriers to care and effective strategies to reach the hardest to reach patients who are otherwise not able to access or afford care. And the local doctors are social entrepreneurs who design effective and innovative strategies to eliminate patient barriers to care. Now I'll describe the basic logistics of this webinar. We're so delighted to have all of you with us today, and we have incredible panelists who have a wealth of expertise to share with you during this next hour. And you can see a lot of the tweets that are occurring during the webinar by using the hashtag GHUWebinar, and we encourage you to tweet throughout the webinar. And we have many excellent questions that were submitted throughout the past few weeks for our expert panelists, and we've gathered a few of those questions. If you have additional questions, please submit those on the text box on the left of your screen, and we'll add additional questions throughout this next hour. We'll proceed with having our panelists introduce themselves in alphabetical order, and I'm delighted to introduce to you our first panelist, Cher-Wen DeWitt. Cher-Wen, if you can please begin by introducing yourself, your background and current role, and please share your key guidance about taking programs to the next level.
Hi, thanks, Jennifer. My name is Cher-Wen DeWitt, and I'm a Microfinance Partnerships Analyst at Acre Fund. My career actually began in public health, where I worked in several roles in the U.S. and East Africa in a variety of HIV counseling and prevention programs and community health organizations. After spending 2 years as the Rwanda country director for FACE AIDS, a program of partners in health, I transitioned to begin working for Acre Fund, also in Rwanda, where I spent the last 2.5 years running an agri-dealer input supply program, as well as our logistics team, which delivers quality farm inputs to our member farmers within walking distance of their homes. I'm now currently on our Microfinance Partnerships team, where we're working in a variety of ways to up the profile of organizations who work with smallholder farmers and also increase global provision of those financial services. In terms of my most important lesson, I think that in situations where you're bringing a program to scale, something that I learned is that a really important aspect of systems design is to remember how you plan on growing your team to meet new responsibilities and tiers of management, and it can actually be an easy one to neglect. And I think in addition to actually sorting out the nuts and bolts of a good reporting structure, empowering your managers by building in and understanding the evolution of good incentives for performance is really key in final impact of your program and service provision. And essentially, a beautifully designed system can't shine through without a well-incentivized and supported team.
Excellent. Thank you so much. And Katelyn, if you can also please introduce yourself and also share your background and current role, and as well as your key guidance about taking programs to the next level.
Sure. Good afternoon, everyone. Jennifer, thank you so much for hosting and moderating our discussion today, and it's very nice to be here today with the other panelists this afternoon. My name is Katelyn Fleming, and I direct our programs at Seed Global Health. Seed is a nonprofit organization, and we are based here in Boston, and we work to strengthen health education and delivery in countries which are facing a critical shortage of health professionals. And we do so by working with our partner countries to meet their long-term healthcare and human resource needs. So in my role, I manage the programmatic aspects of our core program, which is called the Global Health Service Partnership. And this is a joint initiative that Seed has with the U.S. Peace Corps and with the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR. So Seed also actually has the support of our founding academic partner, the Massachusetts General Hospital. So our program briefly just works with partner countries to place U.S. physicians and nurses to work alongside local faculty to educate and mentor this next generation of medical and nursing professionals in Malawi, Tanzania, and Uganda. And so we're currently at 13 institutions across 3 countries and are looking to expand to 2 additional countries in the next 3 years. And so also critically under this partnership, we also offer a U.S. loan repayment program for our international service. And so recognizing that there's financial obligations that are a significant barrier for those who want to serve abroad, through private philanthropy, Seed provides up to $30,000 in debt relief for each volunteer to go towards educational, mortgages, or other financial barriers. So from 2013 to present, we've offset over $2.3 million for debt relief for our volunteers. And so I would say that's a brief overview of a program and a little bit with my role. As far as a piece of advice or a lesson to share when it comes to taking a program to the next level, my advice similarly would also be about scaling your program. So in my role with Seed, I've actually seen us grow from a staff from 3 to a staff of 18 in our 3 years. And with this staffing, we've had increased bandwidth, we've had specialized areas of expertise, and increased opportunities and increased visibility. So my advice would be, with these increased opportunities, and as programs continue to expand and grow, Remember to stay true to your mission. Know what your mission is. Know what it is that you do well. What is it that sets your program apart from the other programs? And so when seeking new programs or collaborations, assess how these initiatives fit in with your core mission. So the scope of projects and initiatives sometimes can become larger, whether it's either financial or bandwidth or timelines than I think some of the initial objectives. And if it's not well aligned, it can take you away from your core mission and goals. So be excited about new opportunities and ensure you're staying true to your mission. And critically here, see that your mission is contributing and these new initiatives are contributing to your shared goals with your partners. And this is both U.S.-based partners as well as your international partners.
Excellent. Thank you so much, Katelyn. And Jordan Levy, please introduce yourself as well.
Sure. Hi, everybody. Very excited to be part of this discussion. My name is Jordan Levy, and I'm the Chief External Relations Officer for Ubuntu Education Fund. Ubuntu Education Fund is an organization functioning in the townships of Port Elizabeth, South Africa. And we work with children, as we say, from cradle to career. So over the last 17 years, we've been working in an area that has incredible poverty, and we've realized that the poverty is layered. It's many complex, interconnected obstacles, and it manifests itself differently in different places. But we've built a context-driven model that provides holistic and comprehensive services to the children and the families that we serve, because over these last 17 years, we've seen the investment and the depth that it truly takes to break that cycle and to give these children opportunities. I think if we all consider what it's taken to get us here, even in the most advantageous circumstances, we can understand, whether we're looking at ourselves, our children, or the children in our communities, that it takes a lot to raise a child. And over 17 years, Ubuntu has learned the hard way through mistakes and trial and error and understanding where we've gone wrong, how to innovate and hopefully disrupt a little bit by prioritizing depth over breadth in terms of our program impact, and looking at how deeply and how intensively we can work with a child and their family to change the course of a life, and also doing so in a locally driven way with attention to those that understand the problems because they are closest to them, because it is their deep investment in changing that community. As far as a lesson that we've learned in terms of growing an organization and any advice that I could give somebody who is on that path, I think it's about flexibility, and that we all work very hard in this sector, and therefore, when we're being honest, we can admit that our egos get tied to the projects that we've started, and that we personalize them and that we believe in them. And that's a good thing, and that's about passion. But the potential negative consequence of that is you can be tied to a direction in such a way that could make you inflexible. And being okay with saying that we have made a mistake or that we didn't realize the full scope of the situation, and that we can be flexible and change course would certainly be a key lesson.
Terrific. Thank you, Jordan. And Carter Powers, please introduce yourself as well.
Hi, everyone. Very happy to be joining this webinar. So my name is Carter Powers, and I'm the Chief Operations Officer at Dimagi. Dimagi is a social enterprise, and we deliver open and innovative technologies, primarily targeted at underserved communities everywhere. So we run one of the most widely deployed mobile health or M-health platforms called ComeCare. And we're a cloud-based provider of technology, and we enable organizations to create their own mobile applications and SMS tools through our cloud-based technology without needing to be software developers or technical experts. So ComeCare is one of the most widely used mobile health platforms, and we really focus on frontline workers and frontline workforces. So in global health, these are typically community healthcare workers or community healthcare volunteers. So a few examples of the types of programs or projects that we work on. One based in India, funded by the Bill and Melinda Gates Foundation, really focuses around improving delivery of services of nutrition and of healthcare. We've also been active in the Ebola work in West Africa, and specifically in Guinea have deployed our technology to a contact tracing app trying to follow up and trace various contacts. So overall, our technology helps global health programs really run more efficiently using technology as an enabler. So we've worked with about 150 organizations and deployed CommCare across over 50 different countries. So we work with a wide range of partners, from large organizations like the UN to small grassroots NGOs who are just starting off using mobile technology. So in my role at Dimagi, I lead really all facets of our business operations, which includes business development, sales, marketing, finance, legal, and HR. We are an international organization. Our headquarters is based here in Cambridge, Massachusetts, and we have offices in Senegal, India, and South Africa, as well as staff in several other countries. So overall, the lesson learned in taking new programs to the next level is really to get data-driven as early as possible. So at Dimagi, we really kickstarted this, and I would say a little bit too late. If we'd started earlier, I think it really would have helped us grow along the way. So essentially, you want to decide on outcomes that you really want to see, figure out the best way that you can start to measure those, even if it's pretty manual to begin with. But essentially, if you get data-driven, you should be asking yourself what questions you want to answer and try to work backwards from that as much as possible. And to be data-driven, you can't just collect the data and show the data. You really need actionable outcomes. And what are you going to actually do based on the output of that report? So early as you're starting off as an organization, you can often rely on your gut. But as we've grown and our complexities increased, we really have had to force ourselves to be data-driven about what our mission is and how are we proving to ourselves that we're really accomplishing that. So overall, my recommendation is to think about being data-driven and realize technology isn't the answer, but it's also the people in the process around being data-driven that really leads to success and getting to the next level.
Fantastic. Thank you, Carter. And Andrea Coleman, do we have you on the line now?
Yes, we do at last. I had real trouble getting on the line, so I'm glad to be with you all.
Terrific. So glad to have you now, Andrea. And please proceed to introduce yourself as well.
Yes, thank you, Jennifer, very much indeed. Thanks for inviting me. I'm Andrea Coleman. I'm co-founder and CEO of Riders for Health. Listening to you all, I feel that, one of the things that we focus on is very practical. It's very basic technology. We run and manage the vehicles that deliver healthcare in rural Africa. We know that people are deprived of healthcare and access to education and very basic healthcare simply because the health workers and other health professionals can't reach those communities because the vehicles are unreliable or non-existent. So although we are dealing with technology and people assume in these current days that everything is about new technology, ours is about the very basic old technology of the internal combustion engine. Nevertheless, unless you can reach people with goods and services, information is a wonderful thing, and as the previous speaker said, that being data-driven is absolutely vital, but you also have to have the very, very basic ability to reach people, look them in the eye, be able to understand what their needs are, and be able to get those goods and services predictably and reliably to rural communities. So all our programs are run and managed by people in the countries of the countries in which we work. We work in 8 African countries, including our most recent in Liberia. Liberia is an interesting program for us because we're really focused on ensuring that any of the samples and specimens that are able to show to alert the Ministry of Health that there is an outbreak of Ebola, or to make sure that there are no measles outbreaks or HIV or whatever you're talking about, that you're actually able to diagnose those people quickly and put them on a regime, or make sure that they're isolated, or whatever needs to be done. But the key to it is making sure that you are detecting disease early. We've been in existence now for 25 years. When we first started in global health, people wondered why people with oily hands and doing very practical things like us, what did we have to do with global health? But actually, logistics and supply chain is now recognized as something that's of critical importance. So we motorcycle guys are getting a bit of a place in the sun at last. My recommendation, or my lessons learned, would be that doing the work that my fellow panelists and you are all hoping to do, it's hard. It's tough. And you have to be prepared for that, and you have to be persistent, and we're often doing things that have not been done before, so you have to be convinced that what you're doing is very important. But as the previous speaker said, to be flexible if you're going down the wrong path. But nevertheless, persistence and bravery and courage are often underrated as elements of doing what we all have to do in very difficult circumstances, and often flying against, as it were, the status quo. So that would be my recommendation, not to necessarily think of techniques, but actually to sort of shore up your own character and personality, because it is very important to stick with it and have that courage and persistence.
Fantastic. Thank you so much, Andrea, and thank you to all of our panelists. As you heard, they all have such a wealth of expertise and guidance to share with you today. Now we'll proceed with the question and answer session. And as mentioned earlier, we received questions in advance from you, our audience members, by yesterday's question submission deadline. If you have additional questions, please post them in the text box on the left of your webinar screen. And to start, our first question for Andrea: there's no formula for establishing an effective organization. However, what are some must-have strategies that can help to ensure success?
Well, that really is a difficult one, and because when we started Riders for Health, we certainly had no roadmap, and we had no background at all in global health, in international development. In fact, I am well known for having no, apart from my very, very early years, no formal education of any kind. So I think that you need to be able, wherever you start, whatever point at which you start in looking at global health, and Lord knows there's a lot of need there, and there's innovation to be done, but also development and adaptation of things that have been successful in the developed world. And to look at that environment and really think about both the gaps, and as another colleague on the panel said, to look at what you are best at. What is it you can bring to this that is either unusual, that you can lead on that, or that you can back up somebody else that you can see has a vision or a mission, or has a real something unique that they can bring to this environment. So don't just necessarily think that you have to be the leader, but support somebody who is a leader. If you are the leader, make sure that you have that strength and conviction to take it through. And I really believe that anybody who's successful at anything is a mix of all sorts of things. It's vision, it's understanding, it's knowledge, but it's also your character. So I think all those things you have to attend to and make sure that you are getting the right support or giving the right support to be successful, and making sure you're really filling a gap or addressing a need that is absolutely vital.
Excellent. Thank you, Andrea. And Jordan, what pitfalls do new programs typically fall into, and how can the pitfalls best be avoided?
Sure. Well, there's a lot. So I can concentrate on a few, I think. When we're talking about new programs and new initiatives and new organizations, you normally have kind of what I think of as a founding story. And the founding story is often powerful. It has to do with probably some emotional connection to the problem that you are trying to address with all the best intentions. But often, and I'm sure my co-panelists could share some stories as well on this one, the founding story is not the exact way you end up evolving. The founding story is the passion part, and then the implementation comes from real, and one of my fellow panelists mentioned this, difficult, hard lessons and hard work, and it evolves. And not getting too locked into your founding story is one of the key things that I think organizations should be wary of early. There will be a tendency to try to stick to a very original vision. It's not that you want to stray from your original intent, but often the methodology needs to change as you're experiencing that. And then there's really a number of pitfalls around funding. One of them is not getting enough, and that has to do with developing fundraising mechanisms early. You need to figure out that part of your operation, or how you're going to bring income into the project that you're trying to achieve, and it is very complex to keep these things running, to bring in that income one way or another, and paying attention early and trying to invest in that early is something that's difficult to do, but essential. On the other hand, with the funding, once you have that success, you face a whole new set of pitfalls. And those have to do with being driven by that funding or chasing that funding. There will be a lot of temptation if you do well, if you start to get exposure, if people like what you do, for them to try to drive you, whether it's to scale very early, often before you're ready, or to move in a direction that may better serve an agenda that is not truly yours. There are a lot of organizations out there, there are a lot of funders out there who are trying to achieve things, and they may have the best of intentions, and they may see you as a perfect vehicle to do that. However, their goals might not be the same as yours, and you might truly not be best suited to lay out their mission, to work out their mission. So you have to be very careful about these funding pitfalls and following them. And really, I think it's about developing a strong leadership team and developing a base and a foundation of trust within your organization, an ability to say no to certain things, a true strategic management process, a strategic planning process, a plan and sort of a business plan that you can follow, developing something sturdy early so that you know when to say no. You know what you should be chasing in terms of funding in those areas, and how to stick with your plan as opposed to be co-opted by somebody else's plan that, again, may have the best of intentions or may not have the best of intentions, but either way, it can be a huge pitfall to start to be driven by somebody else's mission as opposed to your own.
Great. And as a follow-up question, Jordan, how do you approach requests by institutions, organizations, or individuals who request that your organization expand to their community? How do you approach those types of requests?
Well, it's quite difficult, and it was significantly more difficult early on. Saying no is a very hard thing to do, and therefore, again, it goes back to drawing up your business plan early. So if you have no boundaries, if there's nothing internally that you decide on in terms of your boundaries, and an organization approaches you, it becomes more difficult to give clear reasoning as to why you're saying no to them, and it can often turn into a dispute internally as to opinion whether or not you should expand to that community. So the first step is to try to decide as early as possible what your leadership team agrees upon as your geographic boundaries. And that's something that I think may not enter into the initial priorities as your strategic planning in the early days, but it's one of those questions you need to put on your checklist to designing a proper business plan, is to draw some geographic or other boundaries that define your organization as much as the services you provide. Once you have that, it becomes a lot easier. If your entire management team, if your organization is bought into your focus area and why, so for example, if you feel that's the area you can provide quality within at a certain moment, it becomes much easier and less pressure-filled, and you can say, well, we don't serve that area, and here's why. I think most people will respect that. Obviously, you can still draw some problems, and especially, as I was referring to earlier, when those groups that are asking you to expand are doing so with funding behind it, it becomes even more tempting. But if your organization is focused and clear on why you don't want to do that at this point, it's okay. You can weather that storm. But if you're unfocused and sort of undecided, you'll be tempted, and often it'll lead to dispute in one way or another.
Wonderful. Thank you so much, Jordan. And Carter, what are key strategies to ensuring that a new technology can be translated effectively into the field?
Yeah, so translating new technology into the field is definitely a huge challenge, and it's even a bigger challenge when you're introducing a technology and then an action on top of that. So essentially in many of our deployments using our mobile technology, oftentimes we're targeting a very low literate population, and that's reading literacy. On top of that, it's often the first time many of these individuals or these health workers have actually used a phone. So we often use the analogy of we are sort of selling something like Microsoft Office, but we first have to get the funding and the education on what a computer is, and then what is this Microsoft Excel that you will use during your period. So it's really challenging bringing new technology to areas that might not have had it. And essentially the most important thing to translate that new technology into the field is you have to go to the field. You have to actually see real users using your technology. As part of our development program with our software developers, we will frequently have them build something first, and then we make a really active point to get them to the field and see real users using our technologies once or twice a year. And as soon as you see what you've designed in isolation in Boston, and then see real users in the field struggling to use your technology, you very frequently redesign everything from scratch. So we really try to get to the field, see real users using our technology to really try to translate it effectively.
Great. Thank you, Carter. And Andrea, what do you feel was most critical to enabling you to expand a small idea into a leading social enterprise?
I think that much of this is about focus. There's so much out there that needs to be done, but if you keep your focus and very much as Jordan was saying, knowing when really to say no to things, and not just necessarily in terms of the funding, but let me give you an example. We run and manage vehicles, and whether that's a motorcycle, an ambulance, or even generators at hospitals and so on. But we've managed to keep very focused on health. And that's been very critical for us because we've learned to understand the kinds of logistics or supply chain that are relevant to a very specific area of healthcare, whether it's outreach for health education or maternal referral, or whether it's to do with diagnosis and sample transport. But you could easily be tempted to do exactly the same, running and managing vehicles, let's say for the Ministry of Agriculture. Well, all of a sudden you're into a very different area of what your financial models would be, how your operational models would work. And so I think that you have to be very focused on what you do and build a knowledge base that is very relevant to the area of expertise that you have. And, all the people that work with riders are local to the countries in which we work. And we recently set up, as I said before, in Liberia, and we set that up with a team of people from 5 different countries, none of them from Liberia in the first place, but all from African countries, to train a Liberian team to run and manage vehicles that will end up being all Liberian. If we didn't have a real depth of knowledge of what we do, what it's focused on, all the elements of what the partners need, what the health requirements are, I think you could easily lose your way. So I think that focus is very important, but knowledge building in your area of expertise is absolutely vital. And understanding, really recognizing that you have to think all the time about lessons learned, reflect all the time on what you did wrong or what you did right, and make sure you learn from it and build that into an institutional memory. That's very hard to do, building that up, but it has to be done, because long term you could so easily make a mistake 10 years down the line that was made in year 1. So just building up that institutional knowledge is absolutely vital. So focus, institutional knowledge, and building up your area of expertise in all your staff across the whole spectrum of your organization.
Terrific. Thank you so much, Andrea. And Jordan, how should programs identify when they are ready to responsibly scale? What are the first most important steps to ensure effective expansion of a program or organization?
In some ways, I think it's a simpler answer than we often make it. We have to see quality. And I think that quality has to be measured in a sense of a deep quality, where you are truly having an effect on your bottom line impact. So if you set out a overall outcome for your organization, you have a vision and a mission and all these wonderful things that go into the pretty logic models, but sometimes we write out these logic models in our monitoring evaluation plans, and then we kind of ignore them when it comes time to make the decision whether or not to scale. So you have to look at those outcomes you were trying to achieve in the first place, and how far along are you actually to those outcomes. What often happens is we see activities that are successful, sometimes in isolation, sometimes in some combination, but they're not actually achieving yet the impact that you set out to have. And unsurprisingly, and not negatively in any sense, meaning development and any of the missions of the organizations that you hear today are long-term. These are transformational objectives and transformational visions. They don't happen overnight, and the truth is they don't happen in a year or maybe 2 years. They happen over long term. And what often happens is we start to see the success of activities, short-term gains that are very real and very important, but we haven't quite had the depth of impact that we were trying to have. And all of a sudden, the success breeds confidence, and deservedly so, and it breeds more funding and all of these things. And then we start to make decisions to scale and to move out and to say, well, if we've had this success here in this place, let's move to the next one. But the truth is, I don't think that success has been often well defined. Secondarily, know the context. In the first intervention, you might be very well suited to provide those activities and those interventions exactly where you are. You may have that local knowledge that is so important, as been mentioned by many of the panelists. But can you achieve that same local knowledge in the next place? And of course, as we see with many successful programs, there are ways to do that, to ensure that local knowledge. And if you have waited and assessed your success properly, and you are in a position to scale, and you can go to that next place and find that local knowledge, surely there is a case for scaling. But for me, it's often a much slower process than we're led to believe.
Great. Thank you, Jordan. And Katelyn, what are some key strategies for establishing effective partnerships with international collaborators?
Sure. Yeah, this is a very important question. So thank you. Thanks for asking this. I would say that there's two critical pieces to this. And first would be to listen and respond to the priorities of your international partners. And the second is really an emphasis on relationship building. So first, with listening to the priorities of your international partners, for us, that's looking at it from a large level, the health system level, and also at the institutional level. So looking at the systems leaders. So for us, we sit down with the Ministries of Health and Ministries of Education to understand training priorities. So it's really critical when you're looking at this that the host country has a sense of ownership and a sense of commitment to the work that we're going to be doing together. So let your international partners drive the conversation and drive their needs because they know it best. And so really it's just listen and learn and respond to the priorities and the needs that they're identifying. And similarly, for us, with our international partners, we also work with institutions, so academic, medical, and nursing schools. So we meet with them, the leadership and the faculty, and ask for their input if this is a program they would be interested in partnering in, having them identify what their training gaps are, their training gap needs are, their human resource needs, what do they see as the most strategic investments at their institutions, and then we can partner with them to address this challenge. So when we continue to meet and discuss these goals and challenges and then adjust. And again, it's having your international partners really drive this conversation and speak to their needs because they really are the ones that know best. And really what's critical, I think, to the success of any partnership is the relationship building. And this really is something that takes time and an investment on all parties. Something that I think is unique that I can speak to with our program to help build relationships actually is the presence that we have at our site. So we have volunteers who are actually living and working alongside at our partner institutions, as well as this partnership with the Peace Corps. So we're able to leverage the Peace Corps' history in global work and their physical presence and infrastructure and relationships with local stakeholders. And the trainings, and also they are able to provide some trainings for our volunteers on this cultural context of the countries where they're living and working. So for example, there's training in Tanzania for volunteers on Swahili. So it really is, we really try to emphasize a long-term investment to foster this relationship building. So working for one-year commitments with our volunteers and where you're working alongside colleagues. And they also work specifically with a counterpart who helps with assimilation and helps guide the volunteer in learning the culture, the structure, and guides the volunteer in learning the day-to-day workings of an institution. So really trying to emphasize this bilateral exchange of information, and they can exchange teaching techniques, clinical techniques, and just trying to emphasize overall bilateral exchange. And we also look for international opportunities for our international colleagues and partners to help here with our panels and conferences here in the U.S. when it's possible, and just again to underscore that importance of bilateral exchanges. So it's really critical, I think, to emphasize that it is exactly that this is a partnership, and there's a tremendous amount that we really can learn from each other, and if we were all committed towards the same unified mission.
Excellent. Thank you, Katelyn. And Cher-Wen, you have additional partnership strategies that have been successful for One Acre Fund.
Yeah, thanks, Jennifer. I think, first of all, that partnerships can be such exciting opportunities, with organizations or institutions that you deeply respect, and there's a lot of possibility there to be greater than the sum of your parts. That excitement, however, can sometimes mean that you just want to come out the gate saying yes to everything. And so when developing effective partnerships, I think that really upfront communication of your own mission and goals, and this is similar to what both Katelyn and Jordan have touched on, is very key in making sure the partnerships are mutually beneficial for each party involved. And that sometimes means acknowledging the things that you can't do, and rather drawing attention to the areas where you know you each have a solid value add. I think because often there's pressure to overcommit to areas of implementation that maybe you don't have as much expertise in, or areas that aren't as aligned with your own activities or mission, it can become a little bit of a slippery slope that can draw resources away from your core programming, or even lead you to under-deliver to that partner if you don't acknowledge that from the get-go. So I think when presented with an opportunity for partnership, it's really important to stop, to ask yourself very frank questions of, and ask your whole team these questions. How will this benefit our clients or our beneficiaries? How will our contribution really complement what this partner is already doing? And really learning to couch those answers in realism while still looking at them ambitiously and pursuing really bold innovation.
Great. Thank you so much. And Katelyn, what are some lessons learned for developing collaborations with long-term sponsors and supporters?
Sure. Again, I think this is critical. What others have also emphasized too is to know your mission, and so know what it is that you do well, and what it is and what are your challenges. And I think then from there you can set your priorities with sponsors and supporters. And so once you're clear on what it is, just be tireless. Be tireless and look for every opportunity to make it happen. For us, and I'd say for many who are here, funding definitely is essential. And so what he had mentioned for us, one of the critical pieces is the funding support that is offered to our volunteers through private philanthropy. And so securing this funding each year for volunteers is critical, so we meet our recruitment targets. So we look at collaborations for recruitment, exploring professional associations, academic institutions, and corporate supporters that can help complement our mission. Specifically, an example, we have an innovative partnership with the GE Foundation that works in lockstep with our mission. So we've teamed up with the GE to pilot portable handheld ultrasound machines, which are used as teaching tools to enhance clinical education. And the collaboration provides not only the ultrasound device for our in-country institution, it's paired with support to help provide training for our institutions. So the nature of this partnership is really working with our mission and a long-term ongoing investment. I do also want to emphasize that the importance of individual supporters here too. So everything from small donations and small support can have an impact. So for us, it can provide a stethoscope or blood pressure cuff to aid in teaching students and caring for patients. It can provide, it's something as small can provide educational materials, textbooks, and resources. And really to remain engaged with supporters is, everything from sending out newsletters and program updates to our supporters and sponsors. We look for stories from the volunteers and people from the field on how their contribution is impacting health outcomes and furthering our mission. So really every piece of this helps. So every sponsor, every supporter, and if you can emphasize that and underscore the impact that everyone can have, they want to remain engaged for the longer term.
Great. Thank you so much, Katelyn. And Cher-Wen, how does One Acre Fund incorporate revenue-generating programs into its model of financial sustainability, and how has the model evolved from the initial concept?
Sure. A really important aspect of our programming is ensuring that our services can be sustainably provided in the long term. And a core premise of our work is that farmers don't often have the right cash flow to pay for the inputs that they want at the beginning of a season, meaning they're missing out on using seeds and fertilizers that could have a really great impact on their harvest and, as a result, their household income. So as a result, we provide easy access to high-quality inputs and training to our farmers before they plant their crops, and then they're able to pay for these products and services little by little over the course of the agricultural season. What this means is that farmers are our customers, and essentially they are our greatest donors and the core of our long-term sustainability strategy. So to make this possible for them, we make sure that we can offer our products at really fair prices and that client repayment is completely flexible, meaning farmers only really need to make payment when they have the money available. In terms of evolution from the initial concept, the great thing about our clients paying for the services is that the ebb and flow of their demand is a really automatic feedback loop for us to find out what it is that they want and what it is that their households need. So essentially, we need to consistently reshape our product and service package season to season to make sure that we're really keeping up with the evolving needs of these families, or else they simply won't elect to enroll and pay for them. So to meet these changing needs, we have a product innovations team which constantly tests new products based on client requests. So over time, we've grown from, at the start, providing really simple packages of only seed and fertilizer to the present day where, depending on the country that we work in, and we're in Rwanda, Burundi, Tanzania, and Kenya currently, to allowing farmers to add on products like solar lamps, water purification systems, adding these other products to their loan packages as their needs evolve.
Great, thank you so much. And Carter, there's often a large focus on creating new ideas and distinguishing oneself in this type of global health market. How do we ensure we're not duplicating services, or how can we encourage the development community to work together on problems rather than creating a new organization?
Yeah, pilotitis is an interesting problem. So essentially the balance is you want a marketplace where new ideas and new innovations can grow, but at some point as you mature an idea or mature an offering, you sort of expect a winner or a sort of right approach to emerge. And I think what's challenging in global health is that it's a very donor-driven space, and it's very difficult for funders to actually evaluate what is a better solution on paper versus many other ideas that also look about the same on paper. So our approach has really been to prove it in the grassroots and let the right programs scale up. So essentially, I don't think we need to be sort of deterring new ideas and new innovations, but I think funders and the market should evolve to come up with new ways to talk about transitions and talk about scales, and not be as focused on the early stage of the smaller funding, more innovative type ideas.
Great. Thank you, Carter. And Katelyn, practically speaking, how can an organization build institutional memory?
That's a really good question. I would say, it's interesting as things scale, as an organization grows and scales. It goes through different levels. So at one point, you probably have a couple of people who are doing all the different systems and all the different processes. And as you are growing, you're establishing different people who are going to be establishing these different roles in different pieces. So, creating systems, developing databases, formal processes, those are all keys to try to ensure the future success of a program.
Thank you. And Jordan, some of the best solutions to challenges in the developing world are being designed and implemented by small community-based organizations that are part of the community they serve. However, they often face barriers in scaling up their solutions or implementing new programs. What advice do you have for these organizations, especially around fundraising, low-cost monitoring and evaluation, and connecting to other innovators?
Well, first they could listen to webinars like this one. Might be very helpful. But, in terms of connecting to other innovators, simple solutions like that are actually out there now. I mean, it's nice that this type of thing is going on. I think when a lot of the organizations on the panel started out, including ours, there was a lot less of this type of sharing. And I think there's a way to be aggressive about that, sharing and getting yourself involved in it. There seems to be a lot of opportunities for it, and then just aggressively networking to connect to those innovators. Learning from those who have been through it is absolutely the best way to do it. And I think people have to realize that most people in this field, if you have a good question and you reach out to them directly by email or in some way, they will gladly give you advice or help you. So there's a lot of ways to connect, and it doesn't necessarily matter what country you're in these days. You can do a Skype, an email if you don't even have that type of access, or some other type of way of communicating. But if you have a question and you really want to pick somebody's brain, I think there's a lot of ways to get access to some people who can really help you, even if it's only for 15 minutes or a half an hour. I think you can learn a lot by those who have done it. As far as specifics, in terms of low-cost M&E, it's using simple Excel spreadsheets and starting to design something that actually works in your organization, as long as it is used for the purpose that is intended. And what I mean by that is decide exactly how you're going to use your M&E system and how it's going to feed back into your organization, and stay focused on that. We talked earlier about staying focused on your mission and not being distracted by a lot of the temptations. The same thing is with M&E, and we talk about being data-driven. Well, when you're small and you don't have a lot of technology, you don't have a lot of data capturers, and you don't have a fancy system, often what you need to do is collect the data you actually need and not try to just fill a huge database with a lot of different things. Understand what's going to drive your programs early, what interventions you truly need to track and how you need to track them, and keep it relatively streamlined and simple, as opposed to trying to create a great wealth of data that you don't have the capacity to sort through. Also, as evidenced by a lot of the partners who are on this call and those that are at the Global Health and Innovation Conference, there's low-cost solutions that have to do with cell phones, and if you can get your hands on some iPads and things like that can often be donated, it can be very helpful technology to use these days that wasn't accessible before. But again, within the capacity that you actually have, don't be overly ambitious at the beginning with your M&E, and keep it streamlined on the goals you want. And as far as fundraising, it's about creating that department early, even if it's one person. But the earlier you can have a dedicated fundraiser and multiple people, hopefully, that are concentrating on what your brand is, figuring out the essence of what you're actually doing, the true impact you're having, and it obviously relates back to your M&E. If you can find a few indicators of success and get those fundraising people out there selling that. Other people on this call talked about differentiating yourself early, understanding what is unique about your idea, your approach, and your vision for your organizational success.
Great. Thank you, Jordan. And now our final question of the webinar for Carter: what are essential lessons learned about navigating cultural differences that impact the success of technology-focused programs?
So cultural differences are extremely important, and having worked across 50 different countries, this is an area where you see it come up again and again, and each time you see it come up, you realize it's even more important than you thought it was. So our approach is really to stick to technology, and then as we use the technologies in all the different local environments, zooming in on the local context is extremely important. So in all of our mobile applications with health content or nutrition content, all of the content typically involves illustrations, multimedia, audio, and we work very hard to make sure that we have local persons in that specific area who provide the sound recordings for the audio and local pictures that represent the local population. So all of our deployments and all of our various projects all use very local, cultural specific content in all of our deployments, and really making it as localized and as context specific where you can absorb a lot of those cultural differences is extremely important for the success of technology in any program.
Wonderful. Thank you, Carter. And thank you so much to all of our panelists who provided such phenomenal guidance and expertise today. So thank you so much for all that you have shared today. And this now concludes our webinar.